patient's face, it's not going to last very long.
Okay.
So what you need to do basically is go deep into these deep, what we call the SMAS, which is the deep layer that invests all of these muscles of facial expression and ligaments, etc., and pull that back and up. That will impart your lift. That's really the money part of this operation. After you've resuspended these deep structures, the skin is redraped over there without tension, and the extra skin is removed. And that's the way to really get this operation done right.
We're going to take a quick break. We come back. Photos. What do you have for us?
Well, I'm going to show you some different examples of the facial rejuvenation procedures that I do, and I have some examples of eyelid surgery, upper and lower, some cosmetic nose procedures, as well as face and neck lifts.
Bags under the eyes? Is that we haven't talked about that?
Sure.
That's an easy one to take care of?
Yeah, you can, if you know what you're doing.
Okay. Could you make somebody look, I mean, like a 60-year-old look what? 5 years younger, 10 years younger?
Usually the goal is 10 or 15 years younger than what they are.
Is that right? You think you can make me look 10 years younger? You know my age off camera?
I think I could, Randy, but you're perfect.
Okay, well, thanks for that. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are here with Dr. Frank Stile, board-certified plastic surgeon. We're discussing what you need to know if you're considering any type of facelifting procedure. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial rejuvenation. With us we have board-certified plastic surgeon Dr. Frank Stile. Okay, so we have some photos. What are we looking at here?
I brought an assortment of pictures here to help explain or demonstrate some of the issues we talked about. And this first picture was a patient who came into my office who had, believe it or not, 3 what she called facelift procedures done in other practices. And she did not understand why she didn't achieve the results that she wanted.
Why didn't she?
Well, basically because these were very limited procedures like the ones we talked about.
Like low downtime.
Right, that use limited scars and threads and other things.
You think they're gimmicky, by the way? Because you smirk when you say that.
I don't think they're gimmicky, but you know, you can't expect expect to have a dramatic result with a small operation. Okay. So basically, what she really needed was a full traditional face and neck lift done the way I described. You know, addressing all of the components. You know,
so what bothered her here in this?
What bothered her was the corners of her mouth and the appearance of her neck. You know, this is a person who is active in the community and works in a job that it benefits her to look younger. Okay. And as you can tell from this to this, what you see is a dramatic change.
What does she say, by the way? What do they say? When it's all done, do they say people didn't know what they had done?
Well, they usually, well, for her, she was very, very emotional about it because she finally got what she wanted, you know, and she feels better about herself and more comfortable about herself in public.
Okay.
The next set of pictures is an example of upper eyelid surgery before and after. And what you see here in this middle-aged male is what I call upper eyelid hooding. Yeah, and if you look at this picture, I want you to notice a few things. What he has is what we call upper eyelid hooding, and what that is where your upper eyelid skin sort of hangs down over your lashes.
It's very subtle, though, by the way.
Well, right, but it makes his eyes look a little fuller and more tired.
Okay.
If you look at the after picture, what you see is his eyes look anatomically the same, but they're lighter, they're opened up a little bit more, and he looks a lot more rested.
Yeah.
Our next picture here is of a woman who had extremely pronounced puffiness of her lower lids. she actually came into my office, and her complaint was that everyone tells her she looks tired or that she hasn't slept at all, and she feels great. She sleeps
bags under the eyes.
Right, basically bags under the eyes, and that's usually caused by the fat pads that we have pushing out, and it's not always a result of aging, because I have young female patients that have this as well, and I'll show it to you
so
after.
Would you do fillers on this woman?
Well, for her, fillers would have been the wrong call. Her issue has to do predominantly with these fat pads that are pushing out, giving her this puffiness. It's very tricky to use fillers.
So what do you do? What do you do, by the way, for this woman, then, if you're not using fillers?
We're taking the eyelid skin down through a very small incision along the lash line, and we're taking a lot of this fat out, being careful not to take too much, which can give a patient that hollowed out look.
Okay.
And if you look at the result, I mean, it's the same patient, but she looks dramatically more rested.
So do you drape it up a little bit? Are you tying up any skin at all?
Well, the eyelid skin is resuspended subtly, but once again, you have to be careful. If you don't do this judiciously, you can get something called an ectropion, where the lid actually comes down. So you just want to take enough, and that's where the artistic part comes in.
This looks good.
Okay, let's look at this next patient. He came in and said, hey,
young guy.
Yeah, he's relatively young, but he said, I look a lot older than I am. I don't like the way my eyes or my neck look. If you look at the preoperative photos, he's got upper eyelid hooding, some puffiness in his lower eyes, and he's also got this fullness in his neck. When you look at these pictures side by side, it's easy to see that the postoperative pictures make him look a lot younger than he was preoperatively.
He does. He looks fit.
Exactly. He looks rested.
Looks a little bit like Rand Seacrest.
He looks, yeah.
To me, he does.
If you look at these, he looks a lot more rested. His jawline looks a lot sharper, and his mandible is a lot more pronounced, and all of these contribute to a more youthful appearance.
What does a guy like this say, by the way? He comes in, you do it, I mean, because it's obviously a great result there.
In terms of his friends and family, they say, hey, he looks a lot more rested and looks younger, but they can't quite put their finger on what he's had done, but they all say, hey, he looks so much better.
He looks like he lost about 20 pounds.
Absolutely, but he really hasn't. It's just his face.
It must be tough, by the way, to get photos from these. Because you do some high-profile patients.
Well, photos are part of all of our medical records, so we get pictures, but whether or not
you can show them on a program,
show them is a different story. Yeah.
Okay. So what else do you have for us?
Well, here, once again, trying to demonstrate that age is not an issue here. I have this young, attractive woman whose issues were lower eyelid puffiness. Right.
What bothered her?
The lower eyelids, once again, with her saying, hey, my lower eyelids make me look like I'm tired.
Little bags under the eyes. Okay.
Exactly. She didn't like them, and we did a lower eyelid blepharoplasty, removing some of the fat and redraping the skin, and she looks dramatically different in terms of...
Okay, now again, our show airs nationwide.
Right.
I talk to a lot of these minimally invasive people that do a lot of fillers. You do fillers too. And, I'm probably more confused than ever, but they will say, Randy, this is a perfect filler patient.
Well, it's interesting that you would say that. This patient's issues were caused by fillers. Believe it or not, she had actually fat transplanted into her lower lids to try to address this crease under her eyelid, and it ended up clumping up, causing this eyelid puffiness in both eyes.
So, bags under the eyes. You got rid of a little bit of the fat. You redraped it or tacked it somewhere? What are you doing?
Actually, it's actually lifted up and tacked into the corner, the canthus, as we call it, of the eye.
So most bags are handled that way?
Yes.
For the most part?
Yes.
Okay, good. Now, in the after, obviously, beautiful before, beautiful after, very pretty. Subtle result, but very good.
Next picture is of just to demonstrate how dramatically changing someone's nose can make them look with respect to age. Here's a young woman on the right who had what we call a dorsal hump and some nasal fullness, and she almost looks middle-aged as a result of it. On the left, her postoperative picture after thinning the nose and lifting the tip makes her look significantly younger.
Yeah, and prettier, by the way. Nose is very nice. You like doing noses?
Yeah, I like them a lot.
A lot of doctors I talk to, they don't like, a lot of plastic surgeons, they say, I don't really like the nose.
Actually, noses and breast lifts are two of the most complicated procedures we have, and I enjoy doing them both, and especially because the nose is on the center of somebody's face.
Yeah.
You don't get many opportunities to do it right, so you have to pick a surgeon who has a lot of experience with it before committing to an operation like this.
We're out of time.
Okay, I'm just going to show you one or two more, Randy, all right?
Okay.
Here's a middle-aged man. He did not like the appearance of his eyelids. his mid-face with the jowling and the fullness of his neck. What we did for him was upper and lower eyelids, and if you look at his eyes are opened up a lot
Very
more.
natural, very nice.
He's got a sharper angle on his neck and mandible here because we did a neck lift on him as well, and just the overall contour of his face is a lot more youthful.
So this is a full facelift? Where'd you hide
Absolutely.
his incisions?
Well, the incisions are basically right out in the open, but if you place them correctly, they look like anatomical landmarks and not like
Where do you put
scars.
them?
Basically along the lobule and on the inside of the ear in the front. In the back, it should be on the hairline, not in the hairline.
So he looks a lot more stylish, by the way, in the
Yeah.
end. Do they do that? People start, they
Sure,
get hip all of a sudden?
They feel better, so they dress better and even change their hairstyles. Here's a similar example of a middle-aged woman who's got a lot of jowling and some pronounced nasolabial folds, and corners of her mouth are down. And we did a neck and lower facelift on her, and she looks a lot more youthful.
Yeah.
A lot happier. And finally, just once again, the major concerns are scars and scar placement. And if you look at this picture right here, the hair is lifted up, the ear is shown clearly. You can't really see the scars. They're not very dramatic or noticeable, even with your hair up, if this is done correctly, Randy.
Okay, okay. We're out of time. A recap. Keys to a natural-looking facelift.
Well, the keys, as far as I'm concerned, are very elementary. You can't get a dramatic result with respect to a rejuvenation procedure with a small operation. This needs to be done addressing the deeper structures and the skin as well. The deeper structures need to be resuspended into a more youthful position. Skin should only be used as a cover and not as a tightening tool. You have to address the face from the forehead down to the neck. If your brows are low, they need to be lifted, but not too much, giving you a look of surprise.
Too high could be bad.
Correct. Eyelids, if there's extra skin, the skin needs to be removed, and fat needs to be removed judiciously so you don't get a hollowed out look. Nasolabial folds can be improved or made less dramatic by a mid-face lift that's accomplished through what I'm talking about, a traditional lift. And the neck has to be addressed the same way, with resuspending the neck muscles and removing the excess skin only. And that's
and you can look 10 or 15 years younger.
Absolutely. It's as hard or as easy as that.
Because 60 or 70 is very young today. I mean, people are living a long time. So what should they look for, in your opinion, in a doctor that's going to be doing a facelift, a surgeon?
They need to find somebody that has a great reputation in the community. They need to meet some of their patients, and it's usually some of their friends who've had these procedures already. They have to trust that this is the most important operation that they're doing. You know, you have to treat each of your patients that way. You have to be meticulous, have attention to detail, and have an artistic eye. And most of all, you have to love what you do.
Okay, and you love it.
Absolutely.
Facelift, one of your favorite procedures, by the way?
It is. I'm really lucky to be doing a job that I enjoy so much.
I want to thank you for coming on the show. Always a pleasure to have you.
Thank you for having me. It's great to be here again.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, this will be on your website as well. We'll also have it on wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.
Then you go down to the mid-face and they say, hey, my nasolabial folds. If something strange happens to women after
nasolabial folds?
It's the line between your nose and the corner of your mouth, and this is a phenomenon that happens to women after 30. For some reason, they start to look at their nasolabial folds a whole lot more. And with age, when you have your skin dropping a little bit more, you have what we call a descent of facial structures inward.
Is that what's happening? It's just the face is dropping?
Exactly, yeah. All the components are there from when you were younger. They've just repositioned into a less attractive or less optimal position. And as they drop and move inward, your nasolabial folds become more pronounced. You get something called marionette lines, which are the lines between the corner of your mouth and your chin, kind of like the marionette puppets. And then they also get a loss of their sharpness on their mandible here, which is called jowling. All of this adds up to make them look a lot older than they really are. Finally, you look at a patient's neck, and there are several things that happen. We have a very broad muscle across here called the platysma. It's usually together and holds all the neck structures up, but with time, this muscle drops and separates, which contributes to an appearance we call banding.
So is the neck one of the first things to go, by the way? I mean, that you see?
I think it's the first thing that actually makes them. It's kind of a call to action for patients. It's what brings them in because they say, look at my neck. I've lost this angle here.
Can the neck be too far gone, by the way?
No, no.
Okay.
They'll say, I'll see myself in a profile picture and I'll have like a line from here to here. I've lost this sharp angle that I had and I have this extra skin, my jowls, etc. A neck is a very important part of a facial rejuvenation procedure. It's very difficult to do either a neck alone or a face alone and get good results. They usually have to be done together.
So is neck easy for you to do?
It is because I've had a lot of experience with it. It was very challenging during my early career or in my training, but it's also a very complex area of the face to address. You know, you have to know what you're doing real well here. The goal with a neck rejuvenation is, number one, resuspending these muscles into a position almost like a sling to bring the neck up. So those bands,
those are muscles?
Yeah, it's the platysma muscle that's opened up, and you get a band, two bands, usually from your chin down to your clavicle.
Where do you put them? What do you do?
You basically reapproximate or put together these muscles in the midline here, and then grab the edges and pull them up. That acts like a sling to resuspend your neck, and it's very important to do. It's very important to do this well to impart a more youthful appearance to your patient. You can't, once again, you can't do these separately in many patients and get an overall good result.
What do you mean separately?
Well, some patients will come in and say, hey, they want their neck done, and they don't want to do anything about any changes that might have happened with their face.
Like their upper part of their face.
Correct, or they want their face done only and not their neck, you know, and when you tell them, they say, hey,
you have to talk them out of it
you'll
sometimes.
Just look like an older person with a young neck.
Okay.
You know, and it's really not what they want.
What about this? What about, you know, somebody watching this? I mean, there's medical spas in every corner, and they're pushing fillers. And I'm backing up, by the way. You're talking about nasolabial
fillers
folds.
are
Why not just do fillers?
Fillers are great for a younger or very limited patient population who do not have very pronounced nasolabial folds. They'll have a line there that can be, you know, made less dramatic by putting a filler in. But a filler is a temporary answer to a problem that progresses with time and gets worse usually.
Okay, is it, I mean, what's happening though, by the way, with this area? Is it fat? Is it muscles?
Well, most patients lose fat in their face as part of aging. You know, even though we tend to gain weight in other parts of our body, we lose it in our face. That gives us somewhat of a hollowed appearance in the mid-face. Also, you have a lot of the muscles of facial expression are becoming lax and drop downwards as the ligaments that retain these become looser with time. See, with the facelift, if you want to do it right, you have to resuspend these structures into their previous, more youthful position. In order for a facelift to be done well, you have to address the deep structures. Skin is only a covering. It is not to be used as a lifting or tightening tool.
Some guys are doing that, just pulling skin, you say.
Right. Unfortunately, what's good about skin is what's bad about skin. Skin will stretch. Skin will loosen with time. So if you're using it to impart a lift into a